Hi, and welcome to another Complete Physio podcast. And I'm joined today by Jake Mully, and we are going to be talking particularly about adolescent athletes and sort of growth-related injuries.
Yeah, no, exactly. Yeah, I mean, it's an area that I've spent a fair bit of time in.
Yeah,
Particularly in elite academy football, but also just exposure in private clinics of that population group.
yeah. Okay, well, should we kick things off by just talking about some of the most common injuries and presentations that we're likely to see?
Yeah, definitely. I mean, lower limb wise, you're definitely more likely to see these sort of almost like traction apophysitis type injuries, but from a growth related perspective, your Sever's disease, your Osgood-Schlatter's disease, and your Sinding-Larsen's, your Hansen's disease. I mean, they're your common ones that typically crop up.
Yeah. So imagine for a moment, I don't know what what those diseases are. So starting with the apophysitis, what's actually happening there? How would it present? If I'm a parent, how do I know what's going on there?
Sure. I mean, these growth related injuries typically occur because as these children grow, the bones grow, but the tendons and muscles take a little bit longer to catch up.
Sure, yeah.
And that causes a bit of pulling on the bone of the tendon.
Yeah.
So typically a lot of people describe a bit of a nagging ache, pain over sort of the back of the heel, or around the kneecap.
Yeah.
Especially during activity, jumping, running, those sort of things.
Yeah. And so, again, just in terms of link with that presentation, we hear sort of growing pains banded around a lot, don't we?
Yes.
I've got teenage children, and that's a very almost like a bit of a umbrella term that you hear a lot sort of given. So what would we be looking out for to say it's a growing injury, if you like?
Yeah, I mean, so technically it happens in those age groups where they're going to be going through their peak height velocity.
Yeah.
And that basically means it's the quickest period of growth that they're exposed.
Yeah.
And for girls, it's a bit younger.
Yeah.
In that sort of 11 to 13 age group. And for boys, it's that sort of 12 to 14 age group. So first of all, if they're in that age group, roughly, they'll be at risk of it.
Yeah.
And then things to look out for is, they're usually really active individuals and they're running around, playing lots of sport, extracurricular activities. And if they say, I've got this pinpoint pain over sort of maybe, the tibial tuberosity on the knee, which is basically, at the front of the knee, at the bottom of the tendon, or right on the back of the heel, and they've got this sort of like nagging pain, maybe a sharp pain. They're the things to sort of look out for.
Particularly if they've just shot up growing, I presume. Yeah,
completely. And it's hard to recognise that because if you spend every day with someone, you don't recognise that they've shot up. But if they go and see their grandparents or a friend, and they go, "Goodness me, you've grown," and you're sort of like in that big. In that age group, you might be at risk.
Or their trousers flapping around their ankles.
100%. All those telltale signs that you get with they just grow. They grow like rapidly, and that just exposes them to that risk.
And so I mean, what do we do? How do we manage these problems?
I mean, number one is just understanding what they're doing on a weekly basis.
Yeah.
I mean, you will be surprised how I don't know how I did it, when I was younger, looking at it now, but the amount of activity they do, they're just on their feet, they're running around, they're playing all sorts of sports. They've got PE, and it's about training load management first of all.
Okay.
So trying to manage the total amount of work that they're doing in the week so that, especially during those periods of time. The other things are sort of a lot of balance work. You'll typically see that these age groups, they get a bit more clumsy when they grow. They're just getting used to the new limb sizes. They're like baby giraffes, just sort of plodding around. They don't know what their new limbs are doing. So loads of balance and proprioception work is super important.
Okay. And what about this whole sort of stretching versus strengthening? What's the sort of latest on that?
Yeah, so I mean, it's a little bit mixed. It's one of those sort of contentious areas, and it flicks between, stretchings in fashion, strengthenings in fashion. But I typically say I base it on the person in front of me, and you definitely want to strengthen and there's ways that you can strengthen whilst stretch while strengthening as well.
Okay.
So something called like eccentric training, where you're lengthening the muscles as you're strengthening it.
Yeah.
It's almost like a 2-in-1.
Yeah.
So I typically will go with a little bit of that.
Yeah.
And I typically go down the strengthening route at the moment, but it's not that stretching's the root of all evils. It's more just managing pain and symptoms and things like that.
Yeah. So stretching probably doesn't do as much as maybe we used to in the past think that it did. Yeah.
Yeah, exactly. And I mean, I wouldn't just set up a program of just stretching. Whereas in the past, a lot of people would just try and stretch their way out of these growth-related issues.
Yeah, definitely. That was the way, wasn't it, years ago? Yeah,
completely. And it's trying to mix the two and have a bit of a balance with that.
Yeah. It's always, I think, a difficult one to sort of to get across to patients, right, to anyone really, because on the one hand, we're saying that this is like an overload problem.
Yes.
So the immediate thought is, okay, well, we need to rest it then. Yeah?
Yes.
And then we're being given more load.
Yes.
As a way of resolving it. How does that work?
Yeah. I mean, I try and liken it to a bank balance, and if the muscles and areas aren't tolerating the amount of work, they're becoming overdrawn. So we need to try and increase the bank balance, i.e. the strength.
Yeah.
Now, that is balanced. You've got to look at everything in total, which is basic. You've got to look at everything as a whole. And that's all of their load that they're doing.
Yeah.
And the stuff that I might set them will be a lot less impact than maybe running, jumping, landing. So it's about taking away one thing and giving with another thing to manage that load in total. Yeah.
And I think the point that you make there is really, really important. We get asked this a lot by patients, and it's the difference. And you can, I'm sure, give us some figures and some data on this, between the amount of load that goes through a joint or a tendon when someone runs and jumps versus what you're going to give them to do with a weight.
Completely. I mean, in running and sprinting, you can get sort of up to 9 times body weight going through the calf and the soleus complex. So, but doing a few calf raises, you're not going to hit that. So, by taking away running, but prescribing some sort of calf related exercise, you might be able to manage the load and condition it a little bit more, but not overload it. Yeah.
So it's a different order of magnitude, really, isn't it? Doing any gym based activity versus jumping and running.
Completely. And that's where, the education piece is really important. And you got to speak to the parents and carers and coaches and get them on side with recognizing that not all loading is equal, and that communication piece and education piece is really important in this age group.
Yeah. So if we think about the most common kind of like tendon insertion points that this will happen. So I think you mentioned the Achilles tendon,
Achilles,
patella tendon.
Yeah.
So where should we be particularly sort of mindful of and looking out for these problems occurring?
Yeah, I mean, at the bottom of the kneecap, you can get something called Sindin Larsen's Johansson's. They've all got really complicated names, but bottom of the kneecap basically, and a little bit at the front of the shin bone, so at the tibial tuberosity. They're two sort of key points. Yeah. At the back of the Achilles, is a real key point, and then around the hip. What a lot of people don't realise is that the hip doesn't fully mature till quite late on, even past sort of their teenage years. So that's still a site of contention for those sort of traction and apophysitis and tendon injuries around the hip as well. Yeah.
And even avulsion injuries being obviously at the sort of like on that spectrum as well. Yeah. So
completely. I mean, especially in these sports where there's a lot of ball striking and kicking or really explosive actions. Yeah. The bones are still a little bit softer, and with those big actions, there's a risk of the tendon sort of pulling the bone and causing a bit of a fracture.
Yeah.
So
It actually pulls the bone off. Yeah?
Yes, yeah,
In this age group. Yes. Yeah.
So, and they're injuries that you want to really be mindful of, and pick up early and manage effectively, because that can have some long-term effects on sort of function and pain and things like that. So that definitely needs early identification. So anything where you're getting those like a sharp pain, high level pain after sort of explosive action at any of those sites, it's worth getting checked out for sure.
Presumably anything where someone might be sprinting would be sort of like within that as well.
Sprinting, sprinting, rapid throwing, kicking, ball striking, all of those things are your key things to look out for.
Okay, so look, as parents, we're going to Google things when our kids are saying, this hurts, and then they keep pointing to their knee. So if I'm sort of looking to differentiate between a growing related injury or something that might be more serious, and knowing when to sort of seek medical attention, how would I make those decisions, would you say?
Yeah, I mean, I'd say that trying to look at the pattern of the pain and see when it comes on. Does it come on when the child's doing activity, or is it a pain at rest? We don't, if they're getting pain at rest or at night and things like that, that's definitely worth getting checked out for sure. Things where there's been trauma as well, like in terms of a fall or an impact, and there's pain after that, that's worth checking, because we know that their bones are softer, so they're more prone to these sort of maybe like green stick fractures, they call them, which is where the bone splinters a little bit. Because kids will fall down and explore and climb up walls and trees and all sorts of stuff, but it's trying to make sure that we're recognising where, if there's trauma involved and there's still pain, then getting that checked.
And we're thinking sort of growth plate injuries potentially as well,
Growth plate injuries, definitely. And, there's some more sinister presentations around like juvenile arthritis and something we call slipped upper femoral epiphysis, which is around the hip joint. So trying to see whether there's sort of a high level of pain around the hip, maybe a bit of shortening of that limb, struggling with walking, things that are just out of nature, out of that common nature for someone that's previously active. So, and the parents play a really important role in that. I mean, you'll know, you spend so much time with them, what's normal for your kids. It's important to flag things when they're not quite, when it's not quite right.
For sure.
And, a lot of people get that gut feeling that they don't usually, my child doesn't usually complain of this. And it's just worth flagging it before it becomes a bigger issue.
I mean, kids can have a funny response to pain.
Completely. And they might not be able to verbalize it as well. And I mean, I find it hard at the best of times to explain whether my pain's aching, burning, sharp pain. So goodness knows how children need to try and explain it, especially at 9-10 years old. So that's where, going to see someone that's had experience of dealing with this age group, it really helps.
So talk a little bit about how the whole rehab and treatment and management of these conditions may differ from an adolescent or versus an adult.
I mean, I've done a lot of talks and things on this area, and written a few blog posts on this, and it's essentially understanding the differences in anatomy first of all, because then you'll load it differently. You'll load them differently, and also recognise that there needs to be a level of potentially some what I call gamification. So it needs to be fun and engaging. I mean, trying to get a 10-year-old to do 3 lots of 15 calf raises, it's not going to happen. I mean, it's hard enough to get them to come down for dinner at the time you want them to come down for it. But it's trying to make it engaging, link it to the sport or the activity that they want to do. And try and really get them on board with it, and the parents on board with why you're doing it. And another key thing is really about trying to recognise that their kids are supremely active, and trying to keep them in doing what they want to do for as long as possible.
Yeah.
But in terms of loading, there was this whole myth around, lifting weights as kids. And
I mean, we could do a whole blog about this, couldn't we? Really, I mean, it's that things have changed so much, haven't they, in terms of towards attitudes, if you like, towards kids doing sort of resisted training and stuff. So yeah, be very interested to hear about that from you.
Yeah, completely. I mean, previously it was told that you'll stunt your growth and this stuff, but that sort of is a myth that's sort of gone out of being talked about now recently, and it's just about selecting the appropriate load for the individual. And initially I try and make sure that they can do certain movements and key movement actions, squatting, hinging, overhead lifting, without weights, maybe with like a stick or something like that, and make sure they're competent with the movement first of all, and then start to gradually add weight. But it's just got to be appropriate based on what the individual is doing, and what their age is and things like that. But initially it's about getting them competent in those movements, and then starting to add load gradually from there.
And in terms of healing times, recovery times, are they different in younger people?
I would say that compared to adult population, kids heal a lot quicker.
Mercifully,
they've got we'll both know that. It is one of those things that we'll be amazed at how quick they can respond to things. So typically healing timeframes are a little bit quicker. I mean, bony injuries are pretty fixed around that. That takes time for the bones to heal. But once that point's there, they respond and adapt very quickly. Physiologically. So typically the things that will take adults a lot longer take kids a bit less time.
In terms of like their actual rehab, like the dosing, if you like, and recovery times between like episodes of rehab, is that the same for younger people, or is that different as well?
I'd say that particularly it depends on the type of injury, really. And I would say that trying to give a day to 2 days rest between certain types of loading for growth related injuries, for when they're loading it. But some of the mobility stuff you can get them to do every day if they want to. It's about trying to just recognize what the aim is of the activity or the exercise you're doing, and allowing enough recovery. So it might be that you set things that are a little bit more global. So get them to do some upper limb things if their lower limbs need to take a rest, and because they want to be doing stuff and spend time with their teammates or their school friends and things like that. So there's that social element with it as well.
I think pulling kids out of sport's really difficult, isn't it? Like and getting them to rest from their particular sport that they love can be really tricky. And
I mean, I wrote a paper in the BJSM, British Journal of Sports Medicine, and it mentioned a little bit about the sort of psychological impact that injuries can have on kids. Especially.
You see the way I segued that question in there, John? That was like a pro, wasn't it?
It's like we planned it. So
we
so
planned
smooth, it. But we spoke about me and the authors that wrote it. We really highlighted that sort of the psychological impact that it can have. Being out of sport, out of activity, and they're also maturing sort of from not just from a physiological point of view and an anatomical point of view, but an emotional point of view as well. We'll all know sort of these, even us being teenagers, but moods change, things happen in school, and that can impact rehab and stress, and we know that these things have an impact on healing rates and engagement with rehab. And so in this age group, I find it's even more important to consider that.
It's really interesting because, as you say, like we talk a lot about with older people, this sort of like injury impacting upon sense of self and all this kind of thing. It's really interesting to think about, as you say, like the social component that this is going to have on sort of younger people. Very, very interesting.
Completely. And it requires us to have an understanding of that. And, we're not psychologists, but we need to have an awareness that, what's happened to that individual has an impact on their rehab, their quality of life and things like that. And that's where communication with them, communication with the parents and it requires individual context and contextual factors. So, we can find ways to work around injuries as well. I'm very keen on trying to adapt rather than take people out of things, and find a way, so it's very much what can they do? They've injured maybe their knee or their elbow, and that might be 10% of their body. They've got 90% of the rest of their body that's still functioning perfectly well.
Yeah.
So let's try and find them something they can do.
Yeah. Yeah. We talked predominantly about lower limb injuries, haven't we, so far?
Yeah.
Upper limb injuries, what sort of common injuries are we seeing in those younger age groups, would you say?
So the key one I see is your pars fractures. I mean, I can have a debate whether that's classed as lower limb or upper limb.
We're going to call it upper limb.
We'll call it upper limb. Fair enough. So, but these pars fractures, which is basically a stress fracture of the spine.
Yeah.
And again, the same principle applies with, bone growth and things like that, repetitive actions.
Yeah.
I mean, it's something that you want to pick up for sure in these age groups because of the potential long-term consequences.
Yeah. And what sort of sports are we going to see this in?
So you see that in cricket a lot, with that big rotational action that you get in bowling particularly.
Yeah.
You also get it a bit in football from ball striking.
Yeah.
But your gymnastics and your artistic performance and your sort of your creative industry as well. So your dancers, ballet dancers, those big repetitive actions and things like that.
So how are we managing these injuries then? What's the sort of current thinking, if you like, of how to manage these particular injuries? Because obviously these can have a huge impact on and obviously a lot of anxiety for the children and the parents around the people returning to sport. Told that you've got a fracture in your spine is big news for people.
Definitely.
So,
and the first thing is identification. So trying to adequately work out if it is a pars fracture. So that requires typically an MRI scan, but first you pick that up on a physio assessment. You want to see whether they're getting pain extending back and rotating.
Okay.
A bit of a nagging one-sided low back pain in a specific spot, which be quite uncommon in sort of this population. And then, pain at rest. So those sort of things will be giving me sort of, and then the mechanism of injury as well. So what sport are they doing? Like we spoke about, are they doing those actions that predispose them to it? And then from there, the initial management is offload from impact activities for the moment. Okay. Now, again, that doesn't mean they can't do anything. It just means that you might just have to adapt a few things.
Yeah. So if they're a bowler, modification of their action.
Potentially modification of action, initially taking out that side of things, but they might be able to continue doing some level of loading or batting and things like that. Yeah. But it is quite a lengthy injury in the sense of trying to allow that bone to heal and build up sort of back into the sport.
Yeah. And presumably these are always involve some sort of scan or investigation of that nature, yeah?
Typically they do, and sometimes a repeat scan at the point that they want to go back into sport to see whether it's healed and what the quality of that is and it looks like. Sometimes you can be driven by symptoms as well. Yeah. So it's very important to see someone that's probably seen these a few times, which just allows you to know the course of action.
Yeah.
But imaging definitely to confirm it, and then going from there and a graduated return to sport as well.
Yeah. And any sort of, upper limb injuries,
truly upper limb,
truly upper limb injuries that you see a lot of. I mean, I guess some of this is dictated by the nature of the sports that we play. I guess predominantly,
Yeah, I mean, it is that, and you get this thing called little league elbow, which is sort of, again, those injuries in and around the sort of elbow joint, and then, like we mentioned earlier, these green stick fractures are very common in younger individuals. Things where you might fall on an outstretched hand, and we typically hear that in more the sort of elderly population or things like that, where bone quality is a bit worse. But you can get these green stick fractures.
Mm-hmm.
The other thing is in the hand and wrist as well, around the scaphoid. So typically, again, that fall on an outstretched hand, scaphoid injuries can occur in children and young kids as well.
And that's just a bone in your hand, isn't it?
It's a bone just under the thumb, which can cause a lot of issues because it doesn't have a great blood supply, so it doesn't heal very well.
Okay.
Which means that we need to be quick in picking these up and making sure that it doesn't rumble on. Otherwise, it can affect hand and wrist function and lead to long-term issues.
So if someone's presenting with a pain around the sort of area of the scaphoids, we're saying on the sort of thumb side of the hand, we need to have a relatively low threshold for getting these checked out.
Definitely, yeah. Just getting it checked out to see whether there is the potential that it's fractured or broken, because our early identification just means that it can be dealt with a lot quicker. But I definitely have a low threshold for getting people to see me or a healthcare professional if they've got pain around that sort of lower bit of the thumb and that thumb side of the hand and the wrist, to see what's going on there, especially after any sort of traumatic or fall or a fall on an outstretched hand.
And I presume like the shoulder injuries in kids, maybe swimmers and this kind of thing, linked to instability or hypermobility type problems.
And I mean, you mentioned hypermobility. A lot of the people that were doing these sports have great range of movement. I mean, it's one of those things that can predispose you to these injuries. I mean, swimming, like you said, these big movements and rotational movements at the shoulder. You can see these subluxations and dislocations, especially while the muscles are trying to sort of strengthen around the shoulder to provide that support. And these injuries in young, sporty individuals, especially subluxations and dislocations, they can have a high reoccurrence rate. So need adequate rehab and appropriate sort of onward referral at times.
And we mentioned as well, didn't we, about like younger people doing strength training. Obviously, like some of these myths around it have been debunked and attitudes have changed over the years and stuff. And so part of, adolescent and young, part of their training is a lot more emphasis now, isn't there, on keeping them strong as a way of injury prevention, I guess, the same as,
Definitely, and that's where it does tie across into adult training as well. But because as those myths have become debunked, so to speak, recognizing how important training and cross training is. A lot of young people do one sport sometimes, and there's this debate around single sport specialization. So it's so important for kids to get exposure to so many different stimuli, different sports, actions, games and training, to expose their body to different stresses and strains to allow them to adapt and get strong.
Isn't there I believe there's a paper that shows that children that do a wider variety of sports are more likely to be partaking in sport as they get older. Is that right?
Completely, and it's so important around sort of us trying to promote long-term sport and healthy actions, and there's a lot of work done on like long-term athletic development. And that doesn't necessarily mean that you got to be an athlete to do it. It's about just being a kid and giving them the best start that they can do to have longevity in sport and a healthy lifestyle. So and that requires a lot of exposure to different sports and different actions. Like you said.
Yeah. So really getting that sort of diversity at a young age in terms of the sports that they're doing is really setting them up for a much better sporting and active future, potentially.
Definitely.
Well, that's what the research is.
That's what the research suggests, and also the research suggests that even if they go on to do really well in the sport, it actually lends itself to better performance, and I would argue reduced injury risk as well, because they've got that exposure to these different actions, and it's not a surprise to their body when they need to go and do it. But, a lot of sports clubs are encouraging kids to get involved in different sports and different things. I mean, when I was working in academy football, we would try and expose them to within training sessions, trying to get them doing lots of different actions. We'd get them playing tennis, handball, things like that, to try and give them an exposure to upper limb stuff that they wouldn't get, because football's very low limb dominant, and the same it's the same especially for sort of upper limb sports as well.
It's funny, isn't it, how things change? Because I can just remember when I was a kid, kids would always be told you've got to choose between. You can't do can't do multiple sports.
No.
You've got to choose between running and football or something of that nature. So that's sort of less. That's gone now, is it? We're not way of thinking anymore.
That's not necessarily the way of thinking now. It's sort of, let's give them exposure to as much stuff that we can, and as many different sports and activities, and there is carryover with regards to the skills that they develop in different sports. So, all right, granted, parents having to take kids to sort of 4 or 5 different extracurricular activities or sports and clubs.
That was more for the parent, was it?
Potentially. I mean, I know my parents schlepped me up and down the country for judo and things and other sports, but it was very much it's demanding. But that's where you've got to get the parent on board and communicate with them and get them to help them to educate them on what's the best thing for the kid to try and get them exposed to lots of different activities and for their long-term health.
And you talked about integrating, play and games into the rehab, and obviously, diversifying their activity, particularly if they've got an injury that's going to lay them off for a while.
Yes.
So that they don't decondition in other ways, presumably, as well.
And that's where you got to sort of build the rehab program to have elements that still have links to the sport potentially. So, for example, if they've got to do a balance task and you can get a football involved in their footballer, then great, get it involved where possible. Whether that's sort of using the other foot to be able to do volleys while they're standing on a single leg, or if they're a tennis player, just doing some coordination-based stuff with balls and catching and things like that. It's about just being creative, and it's an area that I love working in, because you can really be quite creative with what you do, and it has so many different facets involved with the rehab. And in that paper that I co-authored in the BJSM, we spoke about the sort of multifactorial nature of rehab for these age groups, and it's such a nice challenge as a practitioner, in a really positive way, to work with young people. You get a real opportunity to be creative, consider real MDT approach, and get them back doing what they want to do, and the joy of getting a young person back to being able to go back to what they want to do and socializing with their friends and things like that. It's a great thing. So
excellent. Just in terms of, so we I think we've touched on the sort of cultural mindset component of these things, which I always like to do. And prevention, we're saying a much greater leaning nowadays towards sort of strength and diversifying people's sort of activities as being probably the best way of preventing injuries, maybe.
Yeah, definitely. And, trying to utilize different sort of trying to utilize different sports and different conditions, different sort of exercises to try and give as much exposure to different things is important. But all of these sort of previous myths about sort of just doing one sport, or trying to not lift weights, and even the things like we spoke about, stretching growth related injuries only, and things like this. As we know more and look at the data and the research, we've got a much clearer picture of what we need to do to try and mitigate the risk of injury in these young individuals. So it's a really interesting area in terms of trying to keep them doing the sports that they love and interacting there.
We talked on some of the other podcasts about the difference in levels of injury rate between boys and girls. Are we seeing that also in the younger population? Is there a higher incidence of injuries for girls?
It's more about I think in certain age groups you get higher incidences, like because girls' sort of peak height velocity occurs a little bit younger than boys, so you might get a higher spate of growth related injuries in that sort of 11 to 13 age group than you would in boys. But later on you might get that in boys. Now the other thing is that it depends on the type of sport as well, so and sport and engagement. So you typically see that in those more contact based sports you might get a higher rate of injury and things like that. But there are these new initiatives, warm ups that sort of start to sort of work on prevention. There was the FIFA 11 Plus warm up, which was quite an interesting article that looked at sort of a warm up routine for kids, and that prevented injuries and reduced injury risk and injury rates in individuals. So that's something that can be easily implemented, as part of sports and coaches, especially considering how to reduce and mitigate injury risk in the people that come into their
and these have
sessions.
had very significant impacts, haven't they, on injury rates in these studies where they've looked at these, haven't they? Huge reduction in certain injuries,
massively. And it's such a simple thing that can be done over 10 to 15 minutes, and it's a no-brainer really. And there are ones for specific sports, but there are also sort of more general ones as well. So it is a really interesting area, and there's so much research on it, whereby trying to get sort of warm-ups and certain activities are really, really important with just to try and prepare them for what they're doing.
And I guess the traditional divides and boundaries between the types of sports that boys and girls used to do. I remember when I was a child, it was very sort of like, boys did this, girls did that. I think it's a lot more sort of mixed nowadays as well, isn't it?
I mean, the participation rates in, we saw the traction that women's football's is getting at the moment, which is great. And, that's encouraging a lot of younger girls and women to get into sort of football and sports like that. And the same with rugby and things like that. So it is growing. And you even see it in things like martial arts as well. I think, there's a higher level of women participation in martial arts. And so those typically end up with injury rates looking higher in women, but the participation rate is increasing. So, with more numbers come more injuries.
For sure, yeah. So, but overall, the trend is very positive that this is happening, which, which is great. And I guess it's just, hopefully the science and research is sort of catching up and helping to identify, specific sort of pinch points where we can be working to try to keep, injury rates as low as possible, I guess.
Completely. And you raise a really good point. And a lot of the research that has previously been done is typically very male dominated. But we're starting to see an increase in the number of research papers that sort of are focused on women and girls and things like that. So as we get more data and more information, it should lead to better injury prevention strategies, better management of injuries, and more tailored approaches specific for certain sports, ages, genders, and things like that. So it allows us as clinicians to better help those that come into our practice and we see on a daily basis.
Mm-hmm. Okay, excellent. Well, thank you so much, Jake, for such an interest, providing so much interesting information about such an important topic area. So thank you very much for that.
No problem at all. No, pleasure. Absolute pleasure.